Now it's recording.
Okay. All right, here you go. All right, so you all look right here on the board. Okay, this is in your lab manual, okay? And now for your next lab test, okay, next week, okay, you're gonna have to know this. All right, so let's see how we can do. All right, the upper trapezius, and now what motions is it gonna do? And so we're gonna start with Lee up there. Elevation. All right, you guys, what else does it do? It does one more thing, doesn't it?
Protraction.
Upward rotation. All right, good. All right, Melody, middle trapezius.
Retraction.
Retraction. All right, and so Ryan, lower traps.
Scapular depression and upward rotation.
Very good. And that's with upward rotation. All right, rhomboids. All right, Sabrina, what do the rhomboids do?
Elevation, retraction, and downward rotation.
Okay, so the rhomboids have three things to check, all right? All right, serratus anterior.
Is that upward rotation?
It is.
And
Upward.
protraction?
Yes, I marked the wrong thing there.
Is it protraction? No, I don't have mine in front of me.
No, you're right.
Oh, okay.
There we go. All right, now then remember we're going to just omit pectoralis minor. All right, levator scapulatory.
Elevation and downward rotation.
And downward rotation. All right, so whenever I do these and I look at this chart, I try to find something that makes me remember each one of these muscles. Okay, so for upper trapezius, there's two things to mark, and so that's not very unusual, okay? But now middle traps, there's only one thing to mark, so that's kind of easy for me to remember, just one thing for this guy. All right, lower traps, there's two. Rhomboids, there's three things, so no one else has three. All right, and serratus, and now, and then levator, and now then for each one of these, like look here, this is the only one that does protraction. And so, if you can think about what protraction is, okay, and then you can remember, find some way to remember that that's the serratus. So when you check off this chart, it won't be so tough to remember things. Find something that makes you remember each muscle. So what do we do? What's the motion for protraction when we try to palpate that muscle? It's punching, isn't it? Okay, like a boxer, right? Okay, so that can help you remember that serratus does protraction. And now there's a couple of muscles that do retraction. Okay, and there's one, two, three that are going to do elevation. Okay, so that's the way I remember it. I find something that makes me think of what that muscle does. Anybody got any ideas about how they're going to remember these? How do you think? How are you going to remember lower trapezius? That's the Superman one, isn't it? All right, when you palpate it. Okay, so you know it. So if you have to get into this position, you know it does upward rotation, so you can remember upward rotation, and it's just on the edge of the scapula, so just to pull that edge down to pressure. Okay, all right, let's scroll down. Okay, to the next one. There's a few questions. Oh, no, it's not. That's all right. Okay, there it is. This is where we want to be, right here. You guys, did we do both of these last time? We did upward rotation and downward rotation. Okay, so let's let's do these real quick again, okay? I need a definition for upward rotation. Okay, so, y'all kind of look through your stuff. Okay, Arbor, do you have it? You're fixing this. Who's got the definition for upward rotation? It's when the inferior angle of the scapula moves which way? Very good. Away from the midline, right? And toward the axilla? Okay, so Ryan, tell me what three muscles are going to do this.
The serratus, anterior, upper traps, and lower traps.
Okay, now can y'all do that without looking at your book? So if you cover up your book and you don't look at the board, and then can you name those three muscles? Okay, and you should be able to draw this picture, and I think, what page is that on in your book? 120, is that what page you're on? In your textbook? In the chapter? It looks just like the one that Sabrina's on right there. You have the, yeah, the arrows are drawn right there. Okay, so I want you to be able to draw these arrows. Okay, here you go, upper traps. On the acromion process, pulling toward the skull, the occipital protuberance. All right, lower traps on the base of the scapular spine, pulling toward spinous processes of the vertebrae. And then serratus anterior, right here. So there you have what they call a force couple. Okay, the force couple is you have more than one muscle acting in different directions, causing upward rotation to happen. Okay, and so there's three muscles that make that happen. Okay, so once again, so what are they? Upper trap,
Lower traps. And
serratus anterior. Okay, all right. So now that's going to happen whenever you raise your arms up like this. Okay, and so now we've got to pull our arms down. Bring our scapula back to anatomical. All right, so that's the bottom picture. Here we go, downward rotation. Okay, so we're going to have the inferior angle. I'll make that in blue. Okay, we've got to pull it toward the midline. Okay, and then I'm going to jot down here back to anatomical position. Okay, and there's two muscles to remember. Okay, our rhomboids, and what's the other one? Levator scapula. Okay, so here's the rhomboids right on the edge of the scapula. That's their insertion. And now if they're going to pull towards their origin, there's the line of pull for the rhomboids. So there's the line of pull for the rhomboids, and so it's going to be toward the vertebrae and up. Okay, and if you were going to palpate the rhomboids, you would palpate it right there. Okay, right there where that arrow is. Okay, well, we're not going to do that action. We're going to do another action. Okay, we'll put our hand in the middle of our back and then press it out. Okay, here's the levator on the superior angle, pulling toward the origin. So there's the levator scapulae. Okay, pulling towards its origin, the transverse processes of C1 through C4. Okay, so we have a definition for upward and downward rotation. And we have the muscles that make it happen, and you've drawn a line of pull for each one. Okay, so there's a couple of things on that page. All right, let's scroll down. Okay, we just did that. All right, here we go. You're only going to make this bigger. Well, this is just cranky. There, now it's big. All right, and so we're going to go down the line and answer these questions. All right, and so Y'all help me out on these, because I might like another answer, so y'all tell me. I think the instructions say, fill in the blanks with the following, oh, use each term once is what they're gonna say. All right, so Tori, we're gonna start with you. All right, the spine is on what side of the scapula?
The posterior.
All right. The vertebral border is on what side of the scapula?
Medial.
The glenoid fossa is on what aspect of the scapula?
Lateral.
Very good. All right, now going to the sternum. The xiphoid process is where to the body of the sternum, Leila?
Is it superior?
So this is kind of a tricky one. And so the xiphoid process is way down here. It's the sharp, pointy end of the sternum. Okay, so it's inferior. There's the body. All right, Melody, the rhomboid muscles are located what to the trapezius? What? Deep? Okay, so that, I want to put a big stir by these, okay? These, I want y'all to know these like automatically, so practice, practice, practice. Okay, the coracoid process is on what surface of the scapula, Ryan?
And two.
Very good, very good. Okay, the upper trap is located blank to the levator. Back to you, Tori.
Superior.
Instead of superior, superficial. Superficial. Okay, and then the clavicle is blank to the sternum. And so I have to look at the skeleton to do this one.
Superior lateral?
That's what I like. Yeah, superior, and then we've already used lateral, but I would have, lateral might have been my first pick. So, there we go. Okay, now we want to identify some muscles. All right, and so A is pec minor, you don't have to do it. So I'll just go and scribble that in. All right, now what muscles attach to the vertebral border of the scapula on the posterior surface? And so they'll be, is it yours now, or is it Sabrina's?
I'll do it. Is it the rhomboid? Is that right?
Yes, it is.
On the
Now, you all might have put another one under here. Did anybody else put another one there?
The serrated interior.
Now, that's the next answer. That's the next one right here. I was thinking of another one. Did anyone put levator scapulae on that one? Okay, if you did, I would take it because that's what its definition says.
He's on the superior angle. Right?
Yeah, he's on the, and so some places say he's on the vertebral border between the spine and the superior angle.
Yeah.
But you know what? I go ahead and tell y'all to say superior angle on that one. All right, so very good. But if you did, that would be okay. All right, which one's it? Okay, a superior angle. Okay, it's the next one. All right, which one attaches to the spine? Okay, this is yours, Sabrina.
I'm not sure.
Who knows that? Who's got that?
Is it middle?
It is middle traps. Very good. Perfect. Attaches the where the spine meets the vertebral border. Who's got that?
Is it the lower trap?
Lower trap. Attaches on the transverse processes of the vertebrae.
Upper traps.
Now, he's not on the transverse, but he is on the upper vertebrae, yes. Okay, levator scapulae is the answer for this one. All right, and now G, okay, look at G, attaches on the spinous processes, so all of the trapezius, the rhomboids, I think we got it. All right, Ryan, what do you have for H? Attaches on the ribs.
The serratus and two.
All right. Okay, now we have just a few more. What muscle is located between the rib cage and the scapula? Okay, so that's serratus. Ryan just gave us that answer. All right, what muscle lies deep to the pec major? That's pec minor, you don't have to know that. All right, here we go. Okay, what muscle is most superficial on the posterior upper back? Okay, so, or you could just say traps, that would be great. Upper traps is perfect. Okay, name the muscle innervated by cranial nerve.
Trapezius,
Yeah, and once again, trapezius, and the cranial nerve.
spinal scissor,
Spinal accessory. All right, very good. All right, now then, we did this in lab. Okay, and let's see if I can make that small enough to see. All right, somebody tell me what's the name of this fossa that's right here? What do we got right there?
subscap,
So scapular fossa. All right, what is this big projection that's right here, you guys? Coracoid process. And what is this one?
acromion, process,
All right, now here's your humerus right here. Here's the head. All right, now then what is this groove that's right there? Okay, bicipital. Groove, okay, and I have one here and two here. All right, what is one? Who knows what one is?
greater tubercle.
Greater tubercle of humerus. And number two, they call it lesser tubercle of humerus. All right, and this is top secret right here. You can barely see. There's a little projection that's right there, that midpoint down the humerus. And that is the what? Very good. Okay, deltoid tuberosity. All right, let's do the same thing now for this picture. I'll change it to blue. Okay, we have a big fossa right here. I just make the whole thing be a fossa. All right, what's the name of that fossa right there? And for spinous fossa, right? Y'all got this all labeled, I'm sure. Supra. Spinous fossa, right? Okay, now right here is the head of the humerus. And so look how big it is. And then you can look at the skeleton and you can see how big the head of the humerus is. And then how small the glenoid fossa is, right? Okay, and so now, so if this is the head, okay, just let's go lateral to that. What is this landmark that's right here?
Greater,
It is, the greater tubercle. And so there it is right there, the greater tubercle. Okay, so right here I've labeled that one on the other page, so there it is. All right, and so here we have again our deltoid tuberosity, right? All right, what else? What else do we need on this picture? We have the spine. All right, here's the spine, acromion process, inferior angle. All right, what's the name of this border that's right here? That's right, axillary, and this border. Very good. Okay, so we're getting ready to start the shoulder joint. Okay, but I want to do one more thing to review the shoulder girdle muscles. Okay, and so over there on the back of this page right here, I want you to draw that scapula, if you would. So draw your scapula, use the one that you have right there as a guide to go by. This is a shoulder girdle review. Okay, so this will be the vertebral border. So can you do it just like that? Okay, quick review. Okay, so Ryan, tell me what muscle is hooked onto the spine of the scapula?
The little trap.
Alright, and Melody, tell me what muscle is hooked on way out here to the acromion process, and there's the clavicle. And right here.
The upper traps.
Alright, now let's come all the way down here, Sabrina. What's hooked on down here at the base of the scapular spine?
Lower traps.
Alright, very good. Alright, upper, then right here on the superior angle. Later. Alright, got one more, Tori, right here. Yep, rhomboids. Okay, so you're gonna have to draw this picture on your test. Okay, you're gonna have to draw this on the test. That's one of the questions in the back of the chapter, in your book too, so. What do you think? Can you do it? Let me see if I can make it bigger one more time. Okay, so what do you think? Can y'all do that? You want me to erase it, then y'all practice doing it one more time? Okay. Okay, so go to a clean sheet, don't look at anything. Just flip over to the next blank spot that you've got. Okay, so now, okay, you don't have a scapula to look at. Well, Sabrina has one. Well, down there, it's somewhere on the back of another page. Okay, draw a scapula for me. Okay, and so I just make it like a right triangle, you guys. Well, so you have a 90-degree angle, and then I kind of do it like that. Okay, there's the acromion process. Way out there. Clavicles right there. Okay, now we're gonna start with the top of our muscles, okay? So you've got upper, middle, lower traps, okay? Now do upper trap first, okay? Make an X where his insertion is. Upper trap, way out here. I'm gonna label it UT. Alright, now middle trap. Practice doing that right here. He's all up and down the spine, isn't he? Middle trap. Okay, and so all of these muscles have an action that they perform on the scapula. They elevate it, they depress it, they retract it. So they all have to be attached to the scapula. Alright, lower trap. Got it? Alright, now levator's next. Where does he go?
The top.
Levator scapula. One more. Very good. So rhomboid's right here. Okay, so the vertebral border of the scapula. Okay, the lower traps is at the base of the scapular spine. The levator scapula is on the superior angle. Okay, middle traps on the spine of the scapula. Okay, and upper traps way up here on the acromion process and clavicle. Okay, and so they all have action on the scapula. They make it go up, down, they protract it, retract it. Well, they don't protract it. Where is he? Where is the serratus anterior? It's on the other side, isn't it? Anterior. So when I ask you to draw a view of the posterior scapula, then you put the muscles on it. You won't put the serratus. Okay. All right. Gonna erase this now. Okay, for the shoulder. So for the shoulder girdle, we have a scapula. Okay, what other two bones? Clavicle. And, okay, and then the motions are, what's that? elevation, compression, protraction, retraction, upward, and downward. Those are rotations. Okay, now we're going to change to another joint. Okay, we're going to the next chapter. Okay, the shoulder joint. And it looks, when you look at the words, you know, it has shoulder in both of them. Okay, but now the shoulder joint's going to be where your humerus is. So scapula and humerus, okay? Scapula. Scapula and humerus. Okay, and they may also call this the glenohumeral joint. Okay, and they may call these humeral motions. Okay, and so now we're going to be doing flexion, extension, what else? Okay, rotation, and look, we're going to call it medial and lateral rotation, abduction, adduction, okay, and then horizontal abduction and adduction. So we have a lot of motions here. Okay, so let's practice these motions, okay? So flexion, extension looks like what? To the front and up. Okay, ab and adduction. Okay, and now what plane is that happening in, ab and adduction? Frontal plane, very good. All right, what does this take? What plane is that happening? Very good, okay, good. All right, now then let's do rotation. We're going to start like that and go up like this. Lateral, rotation, back to neutral, medial. Okay, so back to neutral. Okay, lateral, rotation, back to neutral, medial. Okay, or it can be just like this. Okay, lateral, when the anterior surface goes that way, go away from the middle, lateral, medial. Okay, so you're driving in your car, you're getting your car to drive. Okay, reach up for the seat belt. Is that lateral or medial rotation? Okay, and now we got to plug it in.
Medium.
Okay, how about that? Those are two everyday activities that you got to do if you're the driver. Okay, so what else? Okay, so you got to know all these landmarks. Okay, so we're going to start. I'm going to start on this picture. I'm going to start with the anterior deltoid. So if you're in your lab manual or if you've got your handout there, I'm going to go on over to the anterior deltoid because he's the first one in your book that they talk about. Okay, and so I'm going to say a couple of things about each muscle so you can try and remember them. Okay, and so what do you all know about deltoids so far? So Ryan, tell me about the deltoids. What can you think of? Where are they? So this is the one where you get a shot in.
Yeah, right here.
Yeah. If you get a shot, they're going to do it in your arm. They'll do it in that. If it's a intramuscular shot or something like that. Okay. And so that's your middle deltoid that they're giving you a shot in. That helps. That helps to remember which one it is. All right. And so anterior will be first. All right. And so somebody flip over to that page for me, and then I might have this thing a little too big. Yeah. All right, so anterior deltoid, oh, that's too bad. Okay, so anterior deltoid. Okay, the origin is going to be first. Okay, all right, Leila, tell me what's the origin for the anterior deltoid? Okay, so let's draw him on here. And now I like to put a dot right there where the lateral third of the clavicle is. Put some little X's right there. All right, and so I know he's going to go this way, so I'm going to start drawing my muscle fibers. Okay, and so the insertion, all right, and so Leila, what's the insertion? Alright, and so we can draw him down there and we can let these fibers meet just like that, draw the muscle belly. Alright, now the action for this one is kind of important. He's got a lot of actions. We're going to write down 4 things for actions. Okay, so write them down. He's going to do flexion, medial rotation, horizontal adduction, okay, and then abduction. Okay, so this is what he's going to do. Flexion. I'm on the camera.
Oh,
Can you see me? Okay. He's going to do flexion. Okay, he's going to do medial rotation. That means he's going to roll the humerus so that the anterior surface moves to the midline. Okay, and then he's going to do horizontal adduction, bringing that arm across. Okay, and all 3 deltoids are going to do abduction like that. Okay, so let's see how we're going to palpate him. All right, so I want your subject in the sitting position. Okay, and I want you to palpate, okay, 3 fingers down from the origin. Okay, and you're going to ask your subject to flex. Okay, I know that that the deltoids do all of those things, but we're going to test him with flexion. And so y'all do this. Okay, find your clavicle, and you're going to ask your subject, okay, show me where your clavicle is. And so here's your clavicle. All right, let's walk out to the end, all the way to the end. Look how far out it goes. This is how far out it goes. Okay, go 3 fingers down, and then just flex. And there it is. Okay, and so that's how you're going to palpate the anterior deltoid. All right, now what's the nerve for this guy?
Axillary.
Very good. Axillary nerve is part of the brachial plexus. We learned what he was. All right, now I'm going to scroll down, I think, to this side view. Okay, I want to do middle deltoid. All right, Melanie, give me the origin for this guy. All right. That is so easy to remember. Oops. So here it is right here. Make your little dots or make a line, do just like that. And I know he's going to go straight down. I'm going to go ahead and start my muscle fibers. All right, and so Melody, the insertion. All right, and so here he is right here, and he's got little marks on his humerus to show where that is. All right, you finish this muscle out just like that. All right, now what is this guy going to do? Very interesting, this guy. Just abduction, isn't it? Okay, so the anterior deltoid did like 4 things. Okay, but now this middle deltoid, they're only going to give him 1 thing to do. All right, and look, this is all going to stay the same. Sitting position. Okay, 3 fingers down from the origin. Okay, we're going to change the action. Okay, so find this on yourself. Okay, so find your acromion process, like right there. That's where it is, right there. 3 fingers down. Okay, abduct. And you feel that nice strong muscle right there. Right? Everybody got it? If you can't find it, let me know. All right, so there's the middle deltoid. All right, now then, so we've done the anterior, and you can't see that too well from this view, but he would come down kind of like that. Okay, and so now I'm going to do the posterior deltoid. Let me see if I can back view to go to. All right, so I'm going to do posterior deltoid. All right, Ron. Posterior origin. so I'm gonna put it right here. Okay, and if you're not sure where to put it, you can look in your book, or you can come and look at any of our skeletons that are right here. Okay, and so you can see this red line right here on the spine of the scapula. And look, here's the red line on the skeleton, and it goes all the way down the spine. And look, it just goes to right here on the acromion process, and you can follow it all the way around to the clavicle. So here's the deltoids. This is where it is. So they come right down here, and then they hook on right there. Okay, so if you can't figure out where to draw a line, then look at one of our skeletons, and you can. And so then I'm going to make his muscle fibers kind of come down like this. All right, the insertion. Ryan.
The deltoid tuberosity.
All right, we put that right here. And so bring them up to meet the posterior delt. Action, okay, very interesting here. We got some stuff going on, okay?
Shoulder abduction, extension, hyperextension, lateral rotation, and horizontal abduction.
Okay, so he's going to do abduction with the other two guys, but he's also going to do extension. So if you're in flexion all the way up here, you're flexed. Okay, extension, and then hyperextension, like you're going bowling. Okay, horizontal abduction, take it away like that. Horizontal abduction. So if you are honestly going to do bow and arrow stuff, you got to do posterior deltoids need to work. Okay, because that's the bow and arrow movement, isn't it? Okay, and then lateral rotation. Okay, and you use that a lot all day long. You have to rush your air and do stuff like that. So you use lateral rotation all the time. If you've got to get something off the visor in your car, if you've got to fix the rear view mirror, okay, you've got to do that motion. And so if you don't have lateral rotation, you're not going to be able to do it. Okay, and then abduction. Okay, how are we going to palpate it? All right, we want to have this one. We want to have our subject lying prone. Okay, and we want their shoulder abducted 90 degrees, okay, with the arm hanging off the table. Okay, and once again, we're going to do the same thing. Palpate 3 fingers from the origin. So that's not going to change. Okay, but we're going to change this. Okay, we want to do horizontal abduction. Okay, as if you're drawing back your bow, doing your bow and arrow thing. Once again, we're going to do horizontal abduction. Okay, so if you have your subject, just like this, okay, you could bend their elbow, your elbow's not involved, so it doesn't matter what your elbow's doing. Okay, and so you've got 90 degrees, so from here to here, 90 degrees. And look, follow this back to the joint. Okay, so here's the spine of the scapula. You're going to palpate it then right there. And then they're going to draw back the bone arrow. So here it should be right here. What other muscle did we get in this position to do? We went all the way across to here. What other muscle did we do? Was it middle traps? Yeah, okay. And if we could get this lined up 90 degrees and then go right back there, same motion, middle trap. It's going to retract the scapula. Okay, the posterior deltoid is going to do horizontal abduction. Okay, so same position. One here, one here. All right, very good. All right, I want to do one more thing with the deltoids. I'm going to erase this. Okay, y'all make this chart, as I make it up here, y'all make it somewhere on your paper. Okay, I'm just going to make a chart of the 3 deltoids, anterior, middle, and posterior. Okay, and so so I'm gonna look at the actions for each one. Okay, and look, they all three abduct the shoulder. Okay, but I'm gonna put a smiley face right here. Okay, so this is the one that we're gonna test abduction with. Okay, not the others. Right? Okay, and the others we're gonna choose another motion to test. Okay, and so anterior deltoid, let's write down the three things. Flexion, okay, medial rotation, horizontal adduction. Okay, and so whatever is here, I want you to write the opposite for posterior. Okay, so extension and hyperextension, lateral rotation, horizontal abduction. Okay, and now for the anterior deltoid, smiley face by flexion. That's how we're going to test it. All right, and by the posterior deltoid, smiley face by horizontal abduction. That's how we'll test it. Those are the motions that we'll use, right? And so, if you can't remember all three of these, if you can just remember one of them, you can remember the others. If you can just remember the posterior deltoid, by the way, we can also nickname this one Cinderella, right, for the shoulder muscles, because he's just the stepchild. No one ever thinks about him. You never work him in the gym, because you got to get into a funny position, you know, and make sure that it's just him that's getting worked. And so, this one is the poor neglected stepchild, okay? So whatever he does, right here, you can remember this, or if you can't remember it now, you won't remember it. Okay, so if you can remember the anterior deltoid, okay, whatever this one does, this one is the antagonist. Okay, or if you want to say whatever this one does, extension, this is the opposite, the antagonist. Okay, so if that one does flexion, this one does extension. Okay, that one does medial rotation, posterior deltoid lateral. Okay, anterior deltoid does horizontal adduction, bringing it across the front here. Okay, posterior deltoid brings it back. Okay, remember that? That'll help you remember the motions, I hope. Okay? Alright. Let's go to the next one. Okay, the next one I want to do is supraspinatus. I'm going to need a lot of help with this one, because I can never remember what it does. I'm just going to erase all of this, because I can use this picture. All right, Ryan, it's your turn. I think. You still on? Is it Sabrina's turn? All right, Sabrina. Supraspinatus. Okay, so this name sounds familiar. Supraspinous fossa, right here. Okay, so the name sounds familiar. Supraspinous fossa.
Okay.
Okay, that's where it is, right there, kind of hidden. All right, and so we'll write that down and then draw his picture. Supraspinous fossa. Okay, so here it is, right here. Here it is, and so I'm going to go ahead and draw in my muscle fibers, and I want you to look at where they stop. I'm not going to go over. I'm not going over the spine. I'm going to go under. Okay, to get to where it's supposed to be. All right, and so Sabrina, what's the insertion for this muscle? You know what the insertion is? Who's got it? All right, greater tubercle. Right here. Okay, look. So it's going to go just like that. And look, it's going to go underneath the acromion process. And so here he is, right here. Pretend this green pencil is the supraspinatus muscle. And so there he is. Okay, and so he is deep to the acromion process, right? All right, and then what muscle is on top of him right here? Levator and traps, okay. So this is a pretty deep muscle. All right, so I'm gonna write that note right here. I'm gonna put number 1, deep to the traps. Okay, deep to the acromion process. All right, number 3, okay, he makes up, okay, and this is brand new if you haven't heard it before, he makes up part of the rotator cuff muscles. Okay, and then I'm going to write it just like that, S-I-T-S. Okay, so here we have the first one, supraspinatus. Okay, the first one of the rotator cuff muscles, supraspinatus. And if it helps you remember them, these first 3 are all on the greater tubercle. Okay, and you may have known somebody. Have y'all known anyone that's had rotator cuff surgery? I mean, like my mom had it. What does she do? She sews. She makes quilts. All right, and so, but then a lot of people get it that lift things maybe. They're like people that work in storage buildings, you know, and they have to, you know, pick up TVs and put them over here or pick up stoves and stuff. And so a lot of people get that. And so it's this rotator cuff. There is something has happened to these tendons. Okay, and so all of these tendons are right here on the greater tubercle. So there's 1, 2, 3 tendons on the greater tubercle and 1 on the lesser tubercle. Okay, now I'm going to put a number 4 up here. Y'all answer this question. The rotator cuff, I want you to tell me, is it in relationship to the shoulder joint? Is it superior, anterior, lateral, medial? What is it? The supraspinatus. Does it cross superiorly, posteriorly, anteriorly, inferior? Which one? Here it is right here. Superior, isn't it? Okay, let's write number 4. Okay, number 4 crosses the shoulder joint. Okay, superiorly, it's on top. Okay, I'm going to leave that muscle up there, okay, and do the next one. Okay, the next one is very similar. Oh yeah, what is this guy's nerve? What's the nerve for this guy? Thanks. Suprascapular nerve. And so I think what you're going to find out now in this infraspinatus, let's do the infraspinatus. Say nerve. I don't like it. It's hard to remember. It's a long word. Doesn't look like the muscle's name. I'm very annoyed by it. Okay, so we're going to try and remember it. Okay, that means we got to try real hard to remember it. All right, so Aubrey, you got the next one. Okay, origin for the infraspinatus.
The infraspinous fossa of the scapula.
All right, I think I draw it really big compared to what y'all draw it. It doesn't draw it quite that big. Okay, and then I'm going to make his muscle fibers go up here. Okay, the insertion.
It's the greater tubercle.
Tubercle? Yeah, tubercle, isn't it?
Okay.
Here it is. Right here. Look at that. So, look at that. We have the supraspinatus, infraspinatus right there. Okay, action, very interesting here. He crosses the shoulder joint posteriorly So what's he gonna do to that humerus? It's gonna make it do what?
Lateral rotation and horizontal abduction.
Okay, and so I'm gonna put a smiley face by lateral rotation. That's how we're gonna test it. Oh, we didn't write down how to palpate supraspinatus. Okay, nerve, suprascapular. So I have to write down 2 palpations. I forgot to do supraspinatus. I knew there was something. All right, supraspinatus, here's your palpation. Okay, we want to be in the seated position, just sitting. Okay, you stand behind them. Okay, so I'll say with the examiner behind them. Okay, and I want the examiner to palpate. Okay, above the spine. Okay, into the supraspinous fossa. Okay, and it only does abduction, so that's how we're going to palpate that, just do abduction. Okay, and so maybe Tori, can you be the subject of her Tori? This is your arm. Okay, and she's just going to stand with her back to you all. Okay, and so look, you start here, and you walk down. There's the spine of her scapula. And then I want you to say this. Is that the spine of your scapula? Yes. We'll go just above it, just like that, kind of push. And now I got to get out of her way. Okay, now go up to her arm. Yep, just like that. Okay, and so that's her traps right on top of it. And so it's kind of hard to feel this because the traps are on top. But look, this is what the traps do. So if you lift your shoulders up, lift your shoulders up. Okay, don't let them do that. Keep your shoulders down and don't let them move their shoulders. And so there's a little chalk. Okay, so you just got to make sure they don't do this. Do that. All right, that's not hard to do. All right, now then let's do the infraspinatus. This is the last thing that we'll do today. Okay, so now you're going to have your subject lying prone. Okay, and I want the arm I'm sorry, shoulder. Did I forget something? Offer. Did I forget something?
Right.
Oh. For the supraspinatus?
Yeah, but I got it.
Okay. And I'm hanging off the table. Okay, so for the infraspinatus, we're going to have our subject lying prone, and I want their shoulder at 90, and then their arm just hanging off the table. Okay, and y'all, this is going to be the easiest one that you ever find, okay? I want you to palpate the infraspinous fossa, and the only thing kind of hard about that is you got to find it. Okay, and then you're going to do lateral rotation. Okay, and so here's what you're going to do. You're going to say, can you put your hand in the middle of your back? And then you're going to say, is that your inferior angle? And then just go right there. There it is. Okay, so you're going to have your arm like that on the table. Now tell me what motion that you do when you do lateral rotation. Do you ever do anything like that during the day? Have y'all ever had jury duty? You said, I swear I'll tell the truth. Didn't you do this? Okay, so you're going to have jury duty, so I swear I'll tell the truth. I swear I'll be the president, okay? You're going to take the oath of office. All right, that's lateral rotation. Or maybe raise your hand in class, okay? Lateral rotation. All right, and so this one is super, not, it's to me it's easy to find because it's partially superficial where we're going to palpate it. This is going to be superficial. Now then, like way up here, your deltoids may cover up part of it, your traps may cover up part of it, but we're gonna be right there where it's superficial. So this is a nice big muscle that does this lateral rotation. Okay? All right, so we're gonna start here next time. Now, here's what I want you all to get ready to do for next time. Okay? I want you all to memorize origin, insertion, action, nerve. Okay, for these muscles, okay, so anterior deltoid, middle deltoid, posterior deltoid, okay, supraspinatus and infraspinatus. Okay, and so I'm going to have a chart, okay, and I'll have the muscle name right here. I'm going to have origin, insertion, action, nerve. And I'm going to have it for these muscles right here. And so I'll have a couple of them written in, okay, and then you're going to fill in the rest of them. So it's going to be a little 10-point quiz, okay, with these muscles for Thursday. Okay, and now next Tuesday we'll do the rest of the muscles for the shoulder joint. So you can kind of get ready for that for next Tuesday. Okay? All right, I'll see you Thursday. Thank you very much. Thank you for filming that. I'll send it to Morgan and, okay. Okay, anybody got any questions about what you're supposed to do? You know what you're supposed to do, Jordan.
I'm supposed to have page 101 in our web book for.
All the way through.
Will you check out my muscle notebook to make sure I'm doing everything right?
Yeah.
If you don't mind.
Oh, yeah. Very good. Very good. Yep, very nice.
Alright, just make sure we're leaving anything out of it.
Yeah, I mean, it's not a lot, it's just a little bit of stuff. It'll really help you remember it.
Yeah, it is starting to help after drawing it in the lab manual and on this handout and everything. Starting to remember.
Did I give you one of these?
What is that?
Check and see if,
Yeah, I need to get one.
it's the same thing I'm writing on the board.
Yeah, I did get that.
It's on, I mean, it's on Blackboard, I had some copies of
It's
it.
not even there yet. Well, I'll come back to that one day.
I don't know if I gave that out.
And I was gonna ask.
I can talk to him, no, you just get ready and just go over there and take it. And then I haven't- They ran a workshop like all day yesterday.